Assalamualaikum warahmatullahi wabarakatuh. Good evening, ladies and gentlemen. Good day to all of you. My name is Vina Dwitia. I'm a general surgeon of Dustira Army Hospital and surgery lecturer of medical faculty of Jenderal Ahmad Yani University. Today, I would like to share with you all my case report presentation about concomitant presentation of valvular of sigmoid colon with rectal tumor. Okay, I would like to share with you the poster. Approximately 60% of mechanical large bowel obstruction are caused by malignancy, followed by diverticular disease, and 5% are the result of colonic volvulus. Like you know, sigmoid volvulus occurs when the sigmoid colon twists on its mesentery. The etiology of this disorder is not completely understood. It is known to occur in the setting of a redundant sigmoid loop, which rotates around its narrow and elongated mesentery. Predisposing factor to sigmoid volvulus include chronic constipation, megacolon, and an excessively mobile colon. However, presentation as coexisting sigmoid volvulus and rectal cancer is extremely rare. We report a case of concomitant volvulus of the sigmoid colon and rectal cancer. A woman, 36 years old, came to emergency department Dustira Hospital with abdominal pain, distension, and obstipation lasting for 3 days. She also complained nausea and vomiting. 2 months prior to admission, she experienced a change in her bowel habits. She also experienced a change in her stool caliber, and she have reported the weight loss of 4 kilos over a month. She had no surgical history. The patient BMI were normal. The patient vital signs were normal. From physical examination, it was noticed that were distended abdominal and tenderness. Intestinal sounds were strongly audible with increased frequency on auscultation. Laboratory investigation were normal, and from abdominal X-ray demonstrate the existence of dilated bowel segment colon with multiple airfoot level with gas above or step ladder pattern like this. Okay, prior to the urgent laparotomy, the patient went through full resuscitation. In the exploration, torsion in the sigmoid colon and distension in the entire small bowel and colon were observed. And sigmoid colon neurism was normal. When the sigmoid colon was distortion, sigmoid colon was seen to be elongated, and it showed dilatation with edematous serous. And we found also the tumor of the rectum in the proximal rectum. Yeah, this is the structure of the proximal rectum, and we can find a tumor rectum, and this is the colon volvulus sigmoid. The patient underwent decompression, ileotomy, sigmoid resection, tumor biopsy, and colostomy mucosal. Pathologic finding confirmed adenocarcinoma of the rectum. The postoperative course was good. The patient came home with a good condition, and the patient have been referred to digestive surgeon for chemotherapy and they plan for definitive surgery in the bigger hospital. Sigmoid volvulus is one of the 3 most common causes of acute colonic obstruction. And sigmoid volvulus occur when the sigmoid colon twists on its mesentery. It is believed that chronic fecal overloading leads to elongation and dilatation of the sigmoid colon. Sigmoid elongation is a proven etiological cause for sigmoid volvulus. Even though the presentation of colon volvulus with a coexistent tumor of the colorectal is extremely rare, a few cases suggesting sigmoid cancer that leads to sigmoid volve are reported. Lapien et al. Reported a case, and Seung et al. Has reported a case also, a rectal tumor associated with sigmoid volvulus. Wixel and Gordon reported a case of 60-year-old man with an ascending colon volvulus associated with adenocarcinoma of the transverse colon. Based on our case review, it is important for the surgeon to examine the entire colon and rectum when operating the case on cases of colon volvulus to identify concurrent colorectal tumor. Thank you for your attention. Wassalamualaikum warahmatullahi wabarakatuh.